My name is Miriam Cunningham. I'm pleased to share insights into the motivation, methodology, functionality and achievements to date of mHealth4Afrika. In the context of the UN Sustainable Development Goal 3, governments around the world are working towards strengthening the impact of, as well as increasing access to healthcare delivery. Coherent strategies and enabling regulatory environments are required to support universal access to patient-centric healthcare delivery. Equally importantly, appropriate skills development programs, including digital literacy, are required to provide the necessary foundational capacity to facilitate complementing available medical expertise with appropriate health-related technology. In the context of a significant shortfall in available medical professionals in resource-constrained environments, particularly in the African, Caribbean and Pacific Group countries, appropriate technology adoption has an important contribution to make in the context of strengthening impact of and scaling access to healthcare. If technology is to be widely adopted in healthcare ecosystems, the minimum requirement is an appropriate electronic health record, which the WHO defines as real-time, patient-centered records that provide immediate and secure information to authorized users. EHRs typically contain a patient's medical history, diagnosis and treatment, medications, allergies, immunization, as well as radiology images and laboratory results. Despite progress being made across ACP group countries in introducing electronic patient records in larger urban hospitals, paper-based registries are still the default data capture method in most primary healthcare facilities, particularly in Africa. Unfortunately, many of the health technology solutions introduced by donors in recent years have tended to address the specific program that they are funding, such as ART for monitoring HIV/AIDS or TB, for example. Few eHealth or mHealth solutions to date have adopted a holistic approach to patient-centric care or reflect the range of necessary services provided to local communities. There is now increasing realization that using siloed eHealth and mHealth solutions is not sustainable. They tend to have a negative impact on the overall continuum of care, wasting scarce resources through data fragmentation and duplication of effort. 3 years ago, mHealth4Afrika secured funding under Horizon 2020, the European Commission Research and Innovation Programme. Our objective was to co-design a comprehensive patient-centric health platform for use in resource-constrained environments around the world. Designed to be adaptable and extensible, modular and multilingual, mHealth4Afrika integrates electronic health and electronic medical record functionality with the use of medical sensors, decision support, and data visualization tools at the point of care. It also supports automatic counting of aggregate program indicator data required by the Ministries of Health, as well as SMS notifications. Integration has been undertaken with a system designed to streamline laboratory tests for patients. The objective of mHealth4Afrika is to strengthen primary and tertiary healthcare delivery in resource-constrained environments by replacing on a staged basis both hard copy patient registries and any siloed or program-specific electronic health solutions currently in use. mHealth4Afrika is working in partnership with the Ministries of Health, district health offices, clinic managers and nurses in primary and tertiary healthcare facilities in Ethiopia, Kenya, Malawi and South Africa to inform the required functionality, workflow and usability requirements. mHealth4Afrika aims to assist healthcare facilities to increase the quality and impact of care by strengthening the capacity of healthcare professionals to diagnose and treat patients. It makes it easy to both capture comprehensive histories and current medical conditions, as well as identify trends or risks based on previous visits to support continuity of care and follow-up. mHealth4Afrika supports a prevention-focused healthcare strategy by focusing on leveraging appropriate technology to strengthen community trust in healthcare delivery, to encourage greater frequency of contact around all healthcare needs. mHealth4Afrika can save valuable clinical time at health facility level through the automation of aggregate program indicator data, while supporting strengthening of decision-making and policy formulation by significantly increasing the accuracy of this critical resource used by the district health offices and the Ministries of Health. mHealth4Afrika aims to strengthen clinical and diagnostic skills at health facility level by facilitating access to critical educational materials, When developing mHealth4Afrika, collaborative open innovation and design science research techniques and an agile development process were applied. Necessary ethical approval was also secured in each country. We work closely with policymakers, district health officers, clinic managers, and healthcare workers to co-design and validate a number of platform iterations. This iterative, consultation-based approach helped accelerate both prioritizing and incrementally refining program-related data sets, necessary functionality, workflow, and usability issues. Qualitative data collection and ethnographic observation techniques were used during the needs requirement and baseline study and the platform validation phases. While addressing the mandatory program-related data required for use in Ethiopia, Kenya, Malawi and South Africa, when implementing the medical programs such as maternal health, child under 5, TB, ART, etc., mHealth4Afrika was co-designed from a cross-border perspective. Rather than simply replicating country-specific paper-based registries, mHealth4Afrika reflects advancement in medical knowledge. It's built around a superset of data points, incorporating national and cross-border requirements. This can be easily extended to facilitate adaptation and adoption by other countries. Facilitating configurable mandatory and optional data sets support monitoring and follow-up for more complicated cases and facilitate more accurate and early diagnosis as we continue to evolve mHealth4Afrika by incorporating decision support and other technologies. Based on extensive consultation and analysis, mHealth4Afrika identified the requirement to strengthen digital literacy skills of health workers in intervention facilities, to complement application training and general support. Those who successfully complete this training receive certification from mHealth4Afrika and the local university partner in that country. The initial intervention health facilities in northern Ethiopia, western Kenya, southern Malawi, and eastern Cape, South Africa, were agreed with the Ministries of Health and the district health offices. These are a mix of primary health care facilities and hospitals. DHIS2 is used as a national health management information system in many ACP countries, including Kenya, Malawi, and South Africa, and is currently being adopted by Ethiopia. For this reason, mHealth4Afrika investigated whether it was possible for a comprehensive and extensible patient-centric multi-program health platform to be built on top of DHIS2. This offers significant benefits. mHealth4Afrika has developed a comprehensive and extensible patient-centric multi-program custom application that interacts with DHIS2 via a WebAPI. The mHealth4Afrika data model is configured in DHIS2 for each medical program. The data model determines the program structure with its sections, stages, and program rules. The mHealth4Afrika application dynamically renders the data model for each program. This significantly reduces maintenance costs, making it easier to modify and add programs without the use of scarce and expensive technical resources. This design decision supports adaptation, extensibility, and scalability of mHealth4Afrika in resource-constrained environments. It also facilitates the automatic generation of aggregate program indicator data for the Ministry of Health. As well as saving facilities up to 5 person days per month, mHealth4Afrika can guarantee access to timely, accurate aggregate data used to inform health policy and resource allocation. Our approach to interoperability has focused on using HL7 FHIR, initially to transfer medical sensor readings and lab requests and results to and from the patient EMR. To support patient mobility and referral, mHealth4Afrika will use HL7 to support the export and import of individual electronic medical records. The mHealth4Afrika functionality, user interface, and supported programs has evolved significantly over the past 3 years. We've responded quickly to feedback received to iterations of each version of the platform. Based on the level of trust established through this co-design process, user requirements and input have also evolved in sophistication as participating stakeholders see what has been achieved to date and expectations increase accordingly. While we initially focused on maternal and child health, once these programs had been successfully implemented, stakeholders strongly encouraged us to extend the functionality and the programs supported to provide a comprehensive and integrated solution that would facilitate a holistic cradle-to-grave approach to patient care. mHealth4Afrika now incorporates an extensive set of programs and functionality prioritized by participating key stakeholders, including automated counting of program indicators, SMS appointment notifications, and lab result integration. The clinic-related functionality includes the ability to set up, view, and edit healthcare workers as system users, assign program-related access rights based on specific program responsibilities, the ability to add, view, and edit a patient record and search the patient list, the ability to add, view, and edit patient appointments, search the appointment list, and set up SMS notifications. We've added a dashboard which allows the clinic workers access to facility reports and summary reports. In terms of patient-related functionality, this includes a patient profile page, which provides access to a dashboard presenting demographic and program-specific information, appointments, risk factors identified by nurses, the risk profile rendering decision support from the data captured during consultations, and the visualization of program-specific readings and measurements. Each program allows data to be added, viewed, and edited. Programs that have been validated include medical history, maternal health care, family planning, cervical cancer screening, child under 5, including growth and nutrition, immunization, vitamin A and deworming, tuberculosis, antiretrovirus therapy, diabetes, general and specific specialist outpatient clinics. With each program, there are comprehensive patient reports that are automatically generated. They can be printed and exported for further analysis. Health facilities of different sizes may support different programs. The clinic manager can easily select the appropriate programs, set up the users, and assign program-specific access rights based on their responsibilities. mHealth4Afrika was designed from initiation to be used as part of the day-to-day processes within the intervention facilities. 3 validation phases have been undertaken: an alpha, a beta, and a pilot platform, which have allowed the intervention facilities to keep using the platform on a rolling basis, with regular updates providing new functionality and access to more medical programs prioritised with the nurses and facility managers. Based on the perceived success of the initial phases, the Ministry of Health and the district health offices extended the number of intervention sites in Ethiopia, Kenya, and Malawi. During the pilot phase, mHealth4Afrika has been validated in 23 facilities between October 2018 and April 2017. 7 health facilities in the Mara region of Ethiopia, 11 in Bungoma County in western Kenya, which are a mix of referral hospitals, sub-county hospitals, and primary healthcare facilities, and 5 healthcare facilities in Bazamba, Machina, and Blantyre districts in southern Malawi. Several of the larger facilities have medical records captured over a number of medical programs for more than 3,500 patients. This mix of facility types allowed mHealth4Afrika to be validated in different technological environments, with facilities that had different requirements in terms of both functionality and medical programs. The feedback received has been very positive. Some of the aspects considered to be very effective include a clear workflow and effective data capture for different medical programs, providing a consistent, standardized way to collect patient-centric data across all medical programs using electronic health records to maintain, retrieve, and keep longitudinal records. It supports the holistic management of patients, providing the ability to monitor the patient's progress, access to previous medical history, and program consultations. The patient profile page for each medical program allows the health worker to review the patient's medical history quickly and be aware of any critical risk factors and risk profile prior to commencing a new consultation. This saves a considerable amount of time. Dynamic visualisation of vital signs and other readings were considered to be very useful to be able to monitor and track the patient's condition at a glance, identify trends, and support greater consistency in healthcare delivery. Decision support was considered to be very effective. The healthcare workers can see how collecting a small number of additional data points beyond those included in the manual registries can facilitate them to provide better medical care. A simple example is that by capturing both height and weight, the BMI and its meaning is dynamically presented. They're able to see immediately after saving the data from a consultation whether the readings are within normal clinical ranges or risk factors to be monitored and take necessary action. The automatic calculation of aggregate program indicators was considered to be a significant benefit, as this is traditionally done by manually counting pages across multiple health program registries, which is both time-consuming and prone to clerical error. By doing this in an automated way, based on the data captured at a patient-centric level, it improves the quality of data and monthly program indicators. Digital literacy was considered to be a very beneficial part of the medical staff's skills development. And the dashboard provided at the facility provides access to different types of facility reports, lets the facility see the flow of patients and the utilisation of different services over different time periods, and this allows them to better plan resources. I'm now going to briefly show a short demo of some of the mHealth4Afrika functionality. The version I am now demonstrating is for a facility in Ethiopia. When the healthcare worker logs in, they're shown the patient list for all programs for which they have access rights. Here I am logged in as the facility manager, so I have access to all of the programs. One of the practical challenges that mHealth4Afrika faced is supporting two different calendars, the Ethiopian and the Gregorian, without having to support two different code bases. We've addressed this through a data conversion within mHealth4Afrika application. While all dates are stored in DHIS2 using the Gregorian calendar, when the application is used in Ethiopia, the dates are presented using the Ethiopian calendar. When the Ethiopian dates are input, they're saved in the Gregorian calendar. This allows us to maintain one code base while meeting Ethiopian expectations. The user can filter the patient list by program or by name and using advanced search. So we initially started with maternal and child. Then, based on priorities from the intervention facilities that we were dealing with, we then added family planning and cervical cancer screening. We were then requested to add outpatient department and specialist outpatient clinics, diabetes, tuberculosis, and ART. If a nurse logs in who only has program rights for maternal health and family planning, they will only see these two tabs. Now we're going to add a new patient. So we click Add New Patient, and then we can fill out the details for the patient. So we must fill out the mandatory data sets. So the patient type, the enrollment date, the first name, the last name, the medical record number. So here I'm using the Ethiopian calendar. Then we can add specific numbers for different programs that the person may be engaged in. We can add the gender and then the date of birth. Then we can add the language, the occupation, the marital status. And then once we've filled out the mandatory sets, we can save. Here we see the clinic appointment list that's made available to the healthcare workers. Again, it's filtered by the program that the person has access to. So here is the clinic manager. I have access to all programs, so I can see the appointments that each person has, and I can filter it by scheduled date or by status. Here we're going to see the list for the healthcare workers, so those that have access to the system. So when the healthcare workers are set up, they're assigned program rights. So to add a new healthcare worker, we click Add Healthcare Worker. So we would add the username, the password, the first name, the last name, and then the specific groups that the person would have access to. So we can choose one group or we can choose a number of groups. And then when we filled out the mandatory fields, we save the page and then the person has access rights. So it's very easy to use. So within the dashboard, we have access to facility reports, summary reports, and indicators. So here we're going to choose a number of programs. And then we generate the report. So this allows the healthcare workers to see the patients that have participated in these different programs that were selected. We can set the date that we want to know the participation from. It shows you the program and the stage that the person participated in and the last visit. And then in terms of the summary reports, here we've selected 4 programs and a number of comparative years. So this allows the facility to see how many people attended different programs in different years. And then they can see on a month-by-month basis whether how many male patients, how many female patients, how many adults, how many children, and this allows them to better manage resources. And the requirement for this type of reporting came out of practical requirements when the facilities were using a critical amount of data. So now we're going to look at some patient-centric programs. So here we can search for the person we're looking for. We click on the patient we're interested in and we say View Profile. So when we come to the patient profile page, the most basic data that we've access to is the demographics, the risk factors that may be noted by a healthcare professional, and the risk profile. So here we can see that this patient, we have the name, we have the date of birth, we have the medical record number, and because she was in a pregnancy cycle, we have the expected date of delivery. So at the top of each patient-centric page, we have these identifiers, so the nurse knows exactly which patient they're looking at. Here we see the different programs that this patient is enrolled in. So they're automatically enrolled in medical history and the registration program. And then over time, they were added to the maternal health program, then family planning, then cervical cancer screening. Then they went to a specialist outpatient department. And then over their lifetime, they came to outpatient department and they were enrolled in the diabetes clinic. So on the patient profile page, before we go into a specific program, we have access to the risk factors, which are added by the nurse. So as a nurse or healthcare worker identifies specific risks that they wish to flag on the patient's profile, they add a risk factor. Then from the data that's collected through consultations, the system renders decision support. So this is based on the last consultations across a number of different programs that this lady has engaged with. So it shows us that her BP readings are normal, her pulse, her blood oxygen saturation, her temperature at her last consultation was low, her BMI is worrying, her respiratory rate and her hemoglobin are fine, she's at risk for reflux and for diabetes, and her sugar level on the last consultation was normal. So this is dynamically rendered based on the data that's collected for different programs. So this block may be more extensive or less extensive based on the level of detail that's captured during consultations. So this allows the nurse to quickly see any risks that they need to be aware of and take immediate action. So now we're going to go into the maternal program. So now the patient profile page is rendered in a different way. So we have access to the patient overview, which in the case of maternal health is predominantly gynecological information. Then we have access to stages, which in this case is a pregnancy test or a pregnancy cycle. So here this shows you that this lady is on her second pregnancy and she has followed the ANC process. Here we have access to the comparative vital signs from the last reading, and we have access to the risk factors and the risk profile and reports. So now we're going to go into a pregnancy cycle. So we click and we say View, and this brings us now into the pregnancy cycle. So within the pregnancy cycle, we see that this lady was now pregnant with the second baby, and she has followed all of the consultations. So when the stage is marked green, it means that the consultation has been completed. So she attended the 8 A&Cs, she attended delivery and the postnatal services. Here we have access to the appointments she attended, and this is what we've seen on the HIR page, where we've got the comparative readings across each of the consultations, delivery and postnatal. So in the maternal cycle, we've done data visualization for BP, temperature, weight, abdominal circumference. If the facility uses an oximeter, we've done the visualization for the SpO2 and the pulse. And at the request of the facilities, we've added the visualization of the fundal height for the baby, so that they can see that this is going in the right direction. So now this is where we see the decision support after a consultation has been completed. So in all of the programs for the consultations, we split the medical information into different tabs. And this makes it easier for the nurses to capture data quickly. So after they've saved a consultation, the system immediately renders the decision support aspects. So here it shows us the readings that are within normal ranges, the readings that are low. This is what we saw on the patient profile page, that from the BMI perspective, this lady's overweight. And then when we look at screening, so now within the labs, we see that the refus is at risk, the BP is normal, and the syphilis is at risk. So the nurses see this immediately as they save each consultation. Here we're looking at a child. So the layout of the patient profile page is the same regardless of which medical program the person is enrolled in. So we always have the demographics, the program-specific block, the appointments, and the visualization. So the patient overview block is program-specific. So in the case of child under 5, you see the last growth and nutrition, and you see an overview of the last immunization that the child has received. Stages relates to the program-specific consultations that the person would take within this program. So in the case of child under 5, we have at-birth consultation, and then growth and nutrition, childhood illnesses, immunization, vitamin A, and deworming are all repeatable stages. In different countries, the child is brought to the facility on different levels of frequency. So by providing these consultations as repeatable stages, it means that the nurse captures the data whenever the child comes. So if the child is late for an immunization, or if the child is on time for an immunization, they add a consultation and then they record what immunization was given to the child when they actually came to the facility. This shows us the different appointments that this child has been registered in and the fact that she has attended them. And from a visualization perspective, we've rendered the WHO weight for age, weight for height, length for age, and we've also rendered the MUC for nutrition. So this gentleman is registered in the TB program. So in the case of TB, under patient overview, we show the last vital signs, and then we show whether the person, what regime they're on, and whether their adherence is good. So this allows the nurse to see very quickly, prior to starting any consultations, what was the status at the last visit. Then we go into stages, and the TB program has been expanded significantly over the last year by virtue of interaction with specialist TB clinics and hospitals. So they requested that we added a number of additional program stages. So in some countries, they undertake IPT. Then in the case where somebody has been in contact with a TB client, they must be registered legally in a TB contact registry. So this means that anyone who is in contact with a TB client, they must be screened. And there must be a registration of who was screened and why. So that's the TB contact management. Then if the person comes for voluntary screening, either as a result of TB contact or just as a normal course that they have some symptoms that they imagine they need to be checked, they are then added as a consultation for TB screening. So here we see a summary of the data that was collected during that visit, and then if we want to view that visit, we just click on it and view. Then here in this case, this gentleman has TB as a condition, so he's attended a number of TB consultations, and the summary allows us to see the drug regime he's on, his adherence, and his treatment outcome. And if the person's condition deteriorates and they become category 4, which is multi-drug resistant, then the nurse is able to add this stage. So depending on the person, how the person entered the TB clinic and what they're receiving treatment for, this then determines which of these options is filled out for a specific person. In terms of visualization, we do comparative visualization of BP, TB, temperature and weight. So in this case, this gentleman is registered in the ART program. So we see the last vital signs, we see the regime the person's on and whatever information we need to know about their adherence. Then we go to stages, and in the case of the ART program, there's pre-ART or voluntary ART, where the person comes to the facility to be screened, and that is recorded. And then if the person has the condition, then the consultations are recorded each time the person comes to the facility. Here we see the appointments that they've attended, and from a visualization perspective, we have comparative visualization for blood pressure, weight, temperature, but also CD4 results and viral load results. mHealth4Afrika also introduced sensors at the point of care to facilitate the healthcare workers to capture pulse, blood oxygen level, blood pressure, blood sugar levels for diabetes, temperature, weight and hemoglobin. We undertook research across the medical sensors that were available on the market, and we identified a CE-approved set of Bluetooth LE sensors which have been used at the facilities. The nurse interacts with the patient. They then use an Android application which is authenticated with the mHealth4Afrika data model based on the person's login. They then have access to whichever programs they have rights to have access to, and they are then able to retrieve the patient list. They click on the name of the patient, they click on the stage that they are capturing data for within a specific program, and then they push the sensor onto the person's body. Based on the reading from the sensor, this is transferred using Bluetooth LE to the Android application, and this is visualized on the screen. And the reason for this is that the person can see the readings before they're passed to the electronic medical record. When the nurse clicks save, then the Android application passes the readings to the electronic patient record using HL7 FHIR. mHealth4Afrika brings together a consortium with multidisciplinary research and innovation expertise, including human-computer interaction, mobile technologies, sensors for healthcare, health informatics, end-user-driven needs assessment and evaluation, and program-specific expertise. To date, we have developed a state-of-the-art, patient-centric health information system, which is designed to improve primary and tertiary healthcare delivery in resource-constrained environments. It works in both an offline and an online mode. It's been co-designed and validated with Ministries of Health, district health offices and clinicians in Ethiopia, Kenya, Malawi and South Africa. It was introduced on a day-to-day basis in a mix of healthcare facilities, and it supports a wide range of medical programs configured based on analysis of paper-based systems and inputs from clinicians on a cross-border basis to maximize the use of electronic medical records. It's available in English and French, and other languages can be added as required. We're currently validating the system functionality in the programs with health facilities and countries that were not involved in the initial co-design. And we're looking for support to scale the implementation in existing beneficiary countries and other countries, as well as add additional functionality. Thank you for your attention. We look forward to further interaction.